Robert F. Kennedy Jr., a member of the well-known Kennedy family, has been using his massive platform to spread misleading and false information about vaccine safety for many years. With Trump's election victory, Robert F. Kennedy Jr. is now set to have considerable influence over health and food safety policies in the new administration. The new president-elect has even asked him to go wild on America's public health agencies. Now, he is a strong force behind spreading conspiracy theories about vaccines. People who work in health and public health sectors have been left to wonder and worry about what that means for the future of public health. So what role is Robert F. Kennedy Jr. taking in the Trump administration? What major changes in the public health sector is he expected to make, and should you be worried? Well, let's dive right in. Linking vaccines with diseases. Robert Kennedy Jr. has had changing opinions on vaccines over the years. He went from saying no vaccine is safe to linking them with autism, which was eventually debunked, to now coming with a new statement. Just after Trump got elected as the president of the U.S., Robert had this to say: "I've never been anti-vaccine. If vaccines are working for somebody, I'm not going to take them away." Well, if that isn't hypocrisy, I don't know what is. He also stated that he's going to make sure all the scientific studies and efficacy are out there for everyone to look at and assess whether the product is good for them or not. But the truth is, the scientific studies are already out there for everyone to see, and they don't just appear overnight. There's a whole testing process involved in creating and approving a vaccine. During COVID, we even saw a fast-tracked version of this under Trump's administration, which public health experts praised as a big achievement. But typically, it takes a lot longer than what we saw then. Vaccines go through a series of animal trials and then move on to multiple phases of clinical trials to determine if they're safe and effective. Once it shows positive results, vaccines are sent to the FDA, where they go through a detailed review process. The FDA, on their part, holds meetings and even calls outside advisors to weigh in. Companies upload huge amounts of data, and in case they don't agree with the company's interpretation, the FDA publishes its own detailed review as a second check. After the FDA approval, it goes to CDC advisory panels, where further public meetings, reviews, and recommendations take place. They then decide whether a vaccine should be added to schedules, who should get them, and how often they should. Even when these vaccines are out on the market, multiple systems are set up to monitor their safety. So, if everything is already out there for the people, what studies and data is he talking about? And why do you need to worry? You see, while Kennedy says he's not going to remove vaccines from the market, public health experts worry that he could leverage the agencies to slow down the approval, fill his fellow skeptics in the advisory committee slots, and misguide the public like he's been doing for over a decade. What he can actually do depends on who ends up leading the FDA, CDC, and Department of Health and Human Services. The main checks on him going off course with vaccine policies are pushback from the public, Congress, the pharmaceutical industry, and other government officials. The FDA doesn't just pull a product off the market randomly. There needs to be a clear safety concern for the agency to consider a recall. If an RFK Jr. influenced FDA tried to penalize a product without solid evidence, manufacturers could easily sue them, and Kennedy would surely know that. Even though the process is already brutal, he could still order FDA reviewers to request extra data from companies submitting their vaccines for approval. Nobody knows what impact his decisions like this would have on the industry. He hasn't specified what extra data or scientific studies he needs and for what vaccines. The idea of Kennedy taking a senior role in the government greatly alarmed the citizens. The public health experts and federal workers feel like he should not be anywhere near America's health infrastructure. Jerome M. Adams, who served as the U.S. Surgeon General under Trump, also warned his former boss against appointing Kennedy for such an important role, stating he could weaken vaccine confidence and be a driving force behind the resurgence of vaccine-preventable diseases. Being an anti-vaccine activist, even though he says he's not, Kennedy has tried to convince lawmakers all around the world to reduce their vaccine use. He even reached out to leaders in Samoa while the country was struggling with a measles outbreak that had killed dozens of children. This is one of the main reasons why you should be worried about him getting the leadership seat in our health and food sector. He's often made untrue claims that were debunked a long time ago. He also believes vaccines cause chronic diseases in children and led the Children's Health Defense, an organization that says its goal is to end health issues for kids but is known for spreading false information about vaccines. RFK's vaccine skepticism could put children at risk for preventable diseases. He said he wouldn't prevent children from getting vaccinated, but would make it their parents' choice. He has already created confusion through his statements, even among parents who want to get their kids immunized. They may say, you know what, I'm going to learn more, but I don't have time right now to learn more about this, so I'll wait a while. We've already seen declining rates for things like MMR vaccines, measles, mumps, and rubella. But if we focus on kindergarten vaccine rates over the last 5 years, we see a steady decline. They haven't reached the 95% threshold that the CDC wants to achieve, and this is a big problem. If RFK does as he says, which is to significantly reduce the use of vaccines, we might see a resurgence in vaccine-preventable diseases, and it isn't going to be a light blow. Doing this is going to put this country back many, many years and destroy any positive progress we've made in the health sector over the last 2 to 3 decades. Not only this, but if vaccinations go from compulsory to optional, there is a higher chance they will be skipped or not given at all, and people may stop taking them seriously. Right now, there is a vaccination schedule recommended by the Centers for Disease Control and Prevention that makes sure children get the right vaccination at the right time. Many of these vaccinations are given in more than one dose. The point of concern is that if the policy changes, there's a risk of disruptions to vaccination schedules. Currently, most public schools require that children be immunized, with exceptions usually restricted to religious reasons. While fully vaccinated children will be protected against measles and other diseases, it is a huge problem for children who are just starting their vaccination schedule, as they don't know what changes they're going to encounter soon. Vaccines are really important, especially on a broader level, because once the majority of people get vaccinated, you achieve herd immunity, which helps protect against a variety of vaccine-preventable diseases. Childhood vaccination rates. Childhood vaccination rates in the U.S. average around 72%, according to the State Health Access Assistance Center. Iowa has the highest rate at 87.9%, while West Virginia has the lowest at 56.6%. Vaccination rates also vary by ethnicity, with whites having the highest rate at 75.5% and blacks the lowest at 66.5%. If these rates drop, we could see not just uneven herd immunity, but also outbreaks of diseases that vaccines could prevent. Even though he is not part of the government at all right now, RFK Jr. is already succeeding in discouraging people from using vaccines. His influence is likely to generate the biggest changes, and it will only grow if he gets a senior role in the federal government. Nobody knows how Kennedy will go wild in federal health and food agencies. Nevertheless, we should all be worried, as this isn't just about the present, but also the future of this country. Let's hope we don't ever see this man anywhere near our health and food sectors. What do you think about Robert F. Kennedy's motives and stance on current vaccine situations? Do you agree with his statements? And if not him, who should lead the public health and food sectors? Let us know your thoughts in the comments, and don't forget to check our other videos on our channel.